Welcome to this morning's presentation from the PA Family Network, Healthcare, Communication, and Advocacy.
Hi, everyone. My name is Ernie Roundtree, and I'm a Special Olympic athlete, and I'm also a PA Family Network advisor, winning a lot of medals in Special Olympics.
Thank you, Ernie. So who are we? We are a program of Vision for Equality. We have offices in Philadelphia and Harrisburg, but we do cover the entire state of Pennsylvania. We are funded by the Office of Developmental Programs. And we are people with disabilities and family members living all across the state of Pennsylvania. A number of us, most of us, are life course ambassadors. So we are very well trained in the life course framework, and we all have very diverse life experiences. So we like to feel that we can absolutely help you no matter what your journey is. We do workshops for families. We offer technical assistance to families. If you have a specific question about the system, about the Office of Developmental Programs, about anything, please reach out to us. We like to mentor families and their loved ones using the life course framework to really help develop a vision for their loved one for a great life in the community. We work on team mentoring, so that would be a group of people. And we work with system navigation, the Office of Developmental Programs, the Intellectual Disability and Autism System, and developing and identifying supports and services.
And this is why it's for individuals with intellectual disabilities. The role of family is unique and often central in support and care provided across the lifespan. Each family member plays key roles in identifying and securing opportunities for the family members to participate in meaningful ways within their communities and ensuring access to self-determined lives. I love this saying, and it was from the Wingspread report,
which was completed back in the around 2010, I believe, and that is what really propelled the life course framework. So what are we going to talk about today? We're going to talk about how to prepare for a hospital stay, even if it comes as a last minute thing. What are your rights to supports during a hospital stay? And since COVID, a lot of that has changed for the better, so that's very encouraging. How can your supports coordinator help should you require a hospital stay? And what is health equity?
So let's talk about advocacy. What is it? Next slide. Advocacy is supporting or recommending a particular cause, to argue for a cause, to give your opinion to something. And one of my favorites is to stand up for yourself.
And Ernie, do you feel like you are a good advocate?
Absolutely. I know when to say no, and if somebody denies, I don't give up.
I agree. I think you're an awesome advocate.
So as an advocate, no, got the diagnosis, what supports are needed for you, and knowing your rights.
And that is a lot of information. So, you know, little steps, little steps.
I don't know. Here's showing.
So I asked you before, Ernie, but you feel like you're a really good advocate. Can you give us an example in your life of when you had to advocate for yourself?
Sure. I didn't have a good supports coordinator, and I felt uncomfortable that I wasn't getting supported. So I stood up for myself and talked to the boss person at an advocacy event. And weeks later, I got a new supports coordinator.
I love that. That's a great example.
So one of the best ways to advocate, we make a plan and have it ready to go if you need it to go to the hospital or an emergency facility.
Because as we all know, if you plan for something ahead of time, it goes a lot smoother, doesn't it, Ernie?
Absolutely, it does.
So this is just an example of a slide of some of the resources that are available to you to help you really plan for an emergency in a hospital or a doctor's office or any other type of medical facility. These are free to everyone. They are available from these links. The first one is from the Temple University, Emergency Communication for All. And the second one is the Big Red Safety Box, and there is a link to this resource. So Ernie, would you recommend that people look at these ahead of time?
Absolutely. This will probably help you, maybe resources in them in there. So yes.
Right, so that things do go a lot smoother. So the first step you can do is create something called a one-page profile. This is part of the life course framework, but this was adopted from something else. So if you Google one-page profiles, you'll see a lot of great examples.
And yes, and it is actually very fun doing this one-page profile, and the subjects that's on here is what they admire about you or loved one.
Mhm.
The other one is what is important. So putting what's important, what needs, and then after that is what are the best strategies to support you and your loved ones.
And a one-page profile can look like a million different ways, as long as you capture these three sections of very important information. And the PA Family Network advisors can really help you develop a good one-page profile if you need some assistance. So this is just an example of a filled in like one-page profile. But like I said, it's really very, very personalized, right, Ernie?
That's right.
Yeah. What would you say is one of the things that's most important to you?
What is very important to me is knowing who am I, and what makes you happy. The other thing is, can somebody help me find the right choices?
Right. When and where you would need assistance. Absolutely.
The next thing is how to best support one of them is given the choices, not orders. Everybody has choices. The other thing, it's use few and simple words, including treatment. Ask the doctor to give time to respond, or ask for the opinion. And the other one is, when you're feeling a little antsy a little bit, letting them stay in the quiet area. The other thing is to express pains through behavior and to be alert about it.
And once again, these are some ideas. These are not going to be specific to every single person, But these are some ideas that are very common, very popular among people with disabilities. So definitely something to keep in mind when you're making that support plan. So where do you want to keep the plan? Well, let's think about that. You want to have it easily accessible to everyone that would need it. So definitely have a couple different copies of it. Keep a file in your car. So don't you think, Arnie, that maybe if there was a car accident, where is the first place that the police would look? They would look in your glove box.
Glove box.
Right. So keep a file in your car in the glove box.
Yep.
Have the staff that work with you keep a copy, because if something were to happen and the staff would need to take you to the emergency room, they would also need a copy of it, correct?
That is correct.
Keep a USB copy with you. That's a small little USB device where you can download a file, a computer file. Maybe keep that in your wallet, keep that in your purse, something like that. That's actually a good idea. And that takes a little bit of planning ahead because you have to download the file to the USB device. How about keep a picture on your phone? I like that.
Absolutely. I love that.
Mhm. That's something really quick and easy that you can show someone very quickly, or you can share it with someone. Basically, you want a copy of your emergency plan with you anywhere and everywhere you go. How about when you travel, Ernie, like on vacation?
I usually keep it on me, I got a credential, and I write the emergency person to contact in case something happens to me at the airport.
That's a great idea. That's a great idea. And also that brings up another point, Ernie. Maybe this is something that you should share with other people, like your family members. And like if you're going on vacation, share it with the person that you're going to be going to visit.
That's right.
So true or false? In an emergency situation, like an emergency room or going into the hospital, being admitted into the hospital, as long as a person can say yes or no, either by nodding or gesturing or talking, is it true or false that they do not need help? So let's think about that. Do you think someone would need help if they could nod yes or no, or do you think they would be okay on their own?
They would need help.
I think they would. I agree. What do you think, Ernie?
They need help.
They need help. Many people do need help understanding what is happening to them in a hospital, regardless if they have the ability to communicate yes or no, or even regardless if they have very verbal language, very verbal expressive language, because it's a very different, strange, sometimes scary environment.
What about now the other thing is the sign language. They can read the sign language.
Right. And I love sign language, but you know what the downside of sign language is sometimes? If other people don't understand the sign language, that can be frustrating. So having a plan can really help with that frustration. So part of advocacy, if you aren't being listened to, or if you feel like you're not getting the proper care that you need and you deserve, here's just a little breakdown of a medical situation. Usually the first person you have contact with is a nurse. And then from there, a doctor. But remember, when you're in a hospital, you might only see a doctor once, maybe twice a day, whereas you're going to see the nurse all day long. The nurses have a nursing supervisor that you can ask to contact. Then the doctors have the hospital administration, and all hospitals have a patient advocate center, but you need to ask for that. if it is not offered to you. But all hospitals do have a patient advocate available to help. And then through the nursing, they also usually have a social worker that is available. So Ernie, if you were in the hospital and really having a difficult time, of all the people listed here, who do you think would probably help you the most?
Probably the nurse. Because the nurse is there, most of the time.
Most of the time. But it's something to be aware of, that there are different people in a hospital setting that can offer assistance. So if you feel like you're not getting the help that you need, definitely ask for one of these other people. So let's talk for a minute about supports in the hospital. One good thing that has come out of COVID, and that sounds funny, is that the state of Pennsylvania and the federal government made changes to the waiver to allow people to now have support while they're in the hospital. So during the early part of COVID, what we found out is that families could not go to doctor appointments. They weren't allowed to go to doctor's appointments because the doctors were limiting the people that came into the offices. Families could not go into ambulances or emergency rooms often, even if they were wearing a mask, because during COVID, they didn't want the extra people in the ambulances and in the hospitals. Supported individuals, which could be staff, could be family, were also not allowed to help in the hospitals. This created a lot of very scary and sometimes dangerous situations, not just in Pennsylvania, but all across the United States. So this was something that really was hard to predict before COVID, because COVID caught us all off guard. But this is something that they realized very early on. So what were the supports that were most often asked for by a patient with intellectual disability or autism while they were in the hospital? Number one, communication. Because we just talked about whether a person verbally communicates or uses another mode of communication, like sign language, like gesturing, like nodding, even using a communication device. It can sometimes be very difficult to communicate with people that don't know them well. They oftentimes needed intensive personal care. And the reality today is, in all hospital settings, nurses don't have the time to provide intensive personal care. I know my son with Down syndrome, if he was in a hospital, he would never brush his teeth. He just wouldn't. And if a nurse said to him, Sean, go in and brush your teeth, and then left the room, he would not do it. He would need someone there to remind him and to help him a little bit. Same with showering. He could never shower on his own. He would need intensive personal care for that. And then think about behavioral supports. The individual's in a very strange setting, surrounded by strangers, people they don't know, people coming and going, a lot of commotion. That can cause a lot of behaviors that are not going to be easily understood by the staff, by the nurses, by the doctors, unless they are familiar with that. So a lot of behavioral supports. Do federal disability civil rights laws apply to hospitals? Well, this is something we found out very quickly during COVID. Yes, they do. There are several federal disability civil rights laws that can apply to hospitals. Title III of the Americans with Disabilities Act, ADA, Section 504 of the Rehabilitation Act, RA, and Section 1557 of the Patient Protection and Affordable Care Act. That acronym is ACA. All of these statutes protect people with disabilities against discrimination by hospitals. But what we found during COVID was that because hospitals were so overwhelmed and so busy, they were not aware of these civil rights laws. So they were telling parents that they did not have rights when indeed they did. So as advocates, Ernie, isn't it important that we know all of these rights?
Absolutely.
The ADA, RA, and ACA are not suspended during the COVID-19 pandemic. In fact, the United States Department of Health and Human Services Office for Civil Rights, which oversees implementation of those statutes by hospitals, issued a statement specifically saying, reminding hospitals that they must keep in mind their obligations under laws and regulations that prohibit discrimination on the basis of disability. In HHH funded programs, Health and Human Services, and that the federal disability rights laws remain in effect even during the COVID-19 pandemic. And the reality is the COVID-19 pandemic is with us forever. Here, it's staying. It's just ebbing and flowing, going up and down. The U.S. Department of Human Health and Services Office for Civil Rights offers this bulletin, and you can look it up, and here's a link to the bulletin. So here's another piece of legislation, the Isaiah Baker and Margie Harris Alston Act. This bill allows state Medicaid programs like we have here in Pennsylvania to cover certain home and community-based services, self-directed personal assistance services, and home and community-based attendant services that are provided in acute care hospitals. The bill specifies, among other criteria, that such services may not be duplicative of or serve as a substitute for necessary or obligatory hospital services. So what does that mean? It means that Medicaid programs like the waiver program here in Pennsylvania can be provided, those services can be provided in acute care hospitals. However, these services cannot be provided if it's something that the hospital is supposed to already be doing for the person. So the hospital is supposed to be and is providing nursing services. But we talked about a couple minutes ago that it's not providing personal intensive care services. So that's an example. So let's talk about some more service supports in the hospital. Ernie, do you want to take this one or do you want me to do this?
I mean, yes. Sorry. The waiver and supports, it's under an appendix K in now under person family directed supports waiver, community living waiver, and consolidated waiver. And its approved service can be provided to pay staff under certain conditions while in the hospital.
Right, so
yeah.
You're in the hospital. Right now, Appendix K is still active. Appendix K will be expiring before the end of the year, definitely. President Biden has already given a date to stop the federal emergency for COVID-19. So Appendix K will be expiring before the end of the year. However, now under the three waivers, the PFDS waiver, the community living waiver, and the consolidated waiver, there are some services that are going to be allowed to be provided by paid staff while someone's in the hospital. So this is a really, really good change that has come about in the last couple of years. What about your supports coordinator, Ernie?
Absolutely. I have to discuss, yes. Discussing the needs for service in the hospital with your supports coordinator before emergencies and hospitalization happens. So contacting the supports coordinator right away when you're admitted, so the service can be added to your ISP. And also stay in contact with the support coordinator while you're in the hospital.
So as an example, Ernie, say that you tripped in your apartment this afternoon and you went to the emergency room because your ankle was swollen. Would you want to or need to call your support coordinator for that?
One of the parts is, I'm overwhelmed about it, but just to let them be aware of that we were in the emergency room for it.
I agree. I think in that situation, a call to your sports coordinator, leave her a voicemail, whatever's easiest, would probably be a good idea, but maybe not totally necessary. But what if, Ernie, when you tripped and fell and you went to the emergency room and you broke a bone and the emergency room said to you, we're going to need to admit you because we're going to need to do surgery to fix the bone. Should you call your support coordinator then?
Yes.
Absolutely, because you're being admitted to the hospital. There's a high probability that you're going to need some waiver services while you're in the hospital. Wouldn't you say?
I would say.
Absolutely. So remember that your support coordinator is your first contact for the system and for your waiver services. So definitely include them in these major life events. So services in the hospital. Services may also be delivered in an acute care hospital in accordance with section 1902H of the Social Security Act, when the services are, and this is very important, identified in the participant's service plan. They need to be identified in the individualized support plan, the ISP plan. And the services are provided to meet the needs of the participant that are not met, once again, through the provision of hospital services. So let's think about this for a minute. If it has to be identified in the participant's service plan, their individualized service plan, their ISP plan, what do we need to do ahead of time, Ernie?
We have to immediately put it in the ISP.
Yes. Next time you meet with your support coordinator, you want to put something in the ISP plan that under an emergency situation, if the individual had to be hospitalized, that they would need these services during their hospital stay. That will save a lot of time and really help to get those services rolling much quicker if the individual is hospitalized. So once again, be prepared, put it in the ISP plan ahead of time. The services need to be designed to ensure smooth transitions between the hospital and home and community-based settings and to preserve the participants' functional abilities. So what does this mean? The services want to be provided so that there's a smooth transition for when the individual leaves the hospital and they go back home, wherever that home may be, whether they're living in a residential provided home or whether they're living in their own home, whether they're living in their own apartment, etc. And to preserve the participants' functional abilities. So Ernie, I'm gonna pick on you some more with your example with your ankle. So you fell in your apartment, you hurt your ankle, you went to the ER, turns out you had a broken bone, and the doctor said you needed surgery to fix the bone, so they admitted you. Now it's time for you to come back home to your apartment. Well, the services, the waiver services that you received in the hospital helped with your communication, understanding, what the doctors were telling you and what the nurses were telling you. But also, guess what? Now you can't walk without crutches. Or maybe you can't walk even with crutches. So now you're going to need more assistance in your apartment, aren't you? You're going to
Sure, absolutely.
You think you're going to need help with someone preparing your meals?
Absolutely.
Mhm.
And one of the things, and the substitute is I'm also a church person too. So the church families can also help with cooking, preparing a meal for the week for you.
Yeah. And in that case, Ernie, you could be laid up for maybe 6 to 8 weeks easily. So you definitely need to talk to your support coordinator and also your natural supports. I love that example, Ernie, of your natural supports that are available to you. So services in the hospital, and I know we've said this multiple times, but it is important to reiterate, not a substitute for services that the hospital is obligated to provide, okay? Because the hospital is obligated to provide some very specific services while you're in the hospital. So the waiver changes that came about in 2021, remember, so a little after COVID started, these changes align the waivers with the Social Security Act, which was amended by the CARES Act to allow services to be delivered in a hospital. So that's just saying that, you know, in the middle of COVID, when they realized that this was an issue, they got together and changed everything, aligned everything so that the services can be delivered in a hospital. So let's talk about some more of the specific services that can be delivered in a hospital setting to assist the participant with one or more of the following. What's the first one, Ernie?
The first one is communications. You can't do it without that.
Exactly. And how about the second one?
Intensive personal care or the behavior health. Sometimes, you know, you're gonna feel a little antsy about this.
Mhm. So behavioral support is really, really important. I know when my son gets very anxious, when he's scared, when he's upset, he completely shuts down, completely. He doesn't talk, he doesn't communicate, he doesn't do anything. And that's his behavior. So he would need support around that. So some waivers and identified supports. Probably the most common waiver service to use in this situation would be in-home and community support. And that is the waiver service that's pretty much a one-on-one. And that's for a lot of individuals now that live in their own homes and they go out into the community, do some volunteer work, work on acquiring and maintaining their skills. So the support, that would be a great support in the hospital to help with communication, because it would be an individual that knows them well and knows how they communicate. A companion support would just, a companion service would just be a support that maybe to sit with the person overnight in the hospital. They're not really helping them with any skills, but they're definitely there to give them some emotional support to help them maybe overnight while they're sleeping. Because it's scary even in the hospital overnight, isn't it, Ernie?
That's right, absolutely.
And especially at night, there's usually fewer nurses, fewer doctors, and you can really feel alone, can't you?
That's right.
Behavior supports. Behavior services do not allow for intensive personal care if covered by behavior specialist. So if you think you would need behavior services, that is something you want to talk to your support coordinator about ahead of time, so that you have that lined up ahead of time before the individual ends up in a hospital. Supplemental habilitation under supported living, residential habilitation, and life sharing. And once again, that's something that you would want to talk to your provider about ahead of time. So all of this, all of these services really require some planning, don't they, Ernie?
That's right.
They
You
really
always
do.
have to have a plan.
Right. And that's why we're here today, to give you some ideas to get you started on your plan.
Next thing we're going to talk about is everyone deserves the same care. We all want to be equal.
Mhm.
We are all different in unique ways, either race, religion, disability, the gender, the socioeconomic economic status.
Excellent. So regardless of however we're all different, because the world is made up with a lot of different people, and that's what makes it so wonderful, is the diversity. We all deserve the same care and the same attention.
Well, so no matter what, who we are, diversity, we are all human.
Mhm. Absolutely. And we
Nobody's
have way more-
perfect, but we are
Yeah.
human.
and we have way more in common than we do things not in common, wouldn't you say, Ernie?
That's right.
So you froze for a quick second there, Ernie, okay?
Yep, I'm okay. You have the right to health equity. Health equity means is achieved when everyone has the opportunity to be as healthy as possible. And next is the health equality.
So you have the right to health equity. Health equity is achieved when everyone has the opportunity to be as healthy as possible. Health inequities are reflected in differences in the length of life, quality of life, rates of disease, disability and death, severity of disease, and access to treatment. That is unfortunate, but that is a reality that we all have to be aware of.
Tina, the PowerPoint disappeared for me. Did it disappear for anybody else?
Yes, the PowerPoint disappeared.
Okay. Thank you for letting me know.
Sure.
Give me a second. It did not disappear for me, so that's very odd.
You might need to reshare it. Sorry to interrupt.
No
I
worries.
apologize, everyone.
Thanks, Lavender.
Okay. Ernie, it is not letting me. I don't know if this is my internet. This must be my internet, Ernie, because it is not letting me reshare the PowerPoint.
All right, let me see if I can
Oh, wait a minute. Hold on. Maybe here. Hold on. Let me start again. Okay. Can everyone see it now?
okay.
Can you see it?
Yes.
Ernie? Okay.
Yes.
Don't know what happened there. I will tell you that it has been a very funky computer morning.
It has been for everybody.
I don't
If-
know what's going
Start
on.
over with health equity, if you would, Tina. Thank you.
Okay, I'm going back one slide. Okay, so we're gonna talk about, we did talk about how we're all humans and we're all entitled to the same health equity. So go ahead, Ernie.
You have the right to health equity. Health equity is achieved when everyone has the opportunity to be as healthy as possible. The other one is health inequities are reflected in different length of life, qualities of life, rates of disease, disabilities, and death, severity of disease, and access to treatment. And this is from the CDC.
And in a perfect world, there would be no health inequity, but the reality is that it's not a perfect world, and there absolutely is inequities in the healthcare system. And that's something that we all need to be aware of, and we all need to be constantly working on changing. Wouldn't you agree, Ernie?
That's right.
So the ugly truth is there are definitely health inequities. There's inequities just based on where you live. I live in a suburb of Philadelphia. We have amazing healthcare opportunities where I live because of the population. But I know in certain parts of Pennsylvania where it's more rural, you do not have the multitude of medical services that we have. There's inequities among people with disabilities, people of color with disabilities, especially in urban areas, often identifying LGBTQAI+ or transgender are often not receiving equal treatments. But work is being done to change that, and we all need to be part of that solution. So how can we be part of the solution? Well, number one, what should we do, Ernie?
We should learn about staying healthy.
And then what?
And then after that, follow up with the doctor's appointments, get on with your doctor's appointments and medications. The next one is being a good self-advocate or an advocate to other people.
Absolutely.
Next is making a safety plan and keep it up to date.
And I think we gave people a lot of good ideas on how to do that today.
Absolutely.
And then finally,
And the final thing is knowing your rights.
and did we give people their rights today?
Absolutely.
Right. And we will send out a copy of the PowerPoint so that you'll have a copy of the PowerPoint. But definitely there's a lot of different steps that go to that all work together so that we can all have better access to healthcare. So racism, disability, and health equity. For more information, you can go to these two resources. They're both from the CDC, the Centers for Disease Control, I believe is what CDC stands for. But for more information, you can go to these two resources. Healthcare, communication, and advocacy. Know how and when to speak up. Right, Ernie?
Right. Learning how to say no, learning how to say, I need help with something.
And then what's next?
The next one is how to make a plan and keep it updated. We always have to have a game plan and keeping it up to date.
Right, so it is a fluid document. It's a document that's going to change. So you definitely want to keep it updated.
The next one is knowing what you need to communicate.
And that's interesting because if you asked my son, he thinks he communicates perfectly fine, but in reality, he doesn't. So as his family members, as his caregivers, that's up to us to make sure that information gets into his healthcare plan.
Next thing is not everyone is treated equally, and you need to be aware of it.
Which brings it back to advocating for yourself, correct?
That's correct. And the last one, which is my favorite, is knowing your rights.